Calling to order the Cuyahoga County Health and Human Services and Aging Committee. Wednesday, May 3rd, 2023, Cuyahoga County Administrative Headquarters, the C. Ellen Connolly Council Chambers. It is approximately 1:05. Madam Clerk, would you please call the roll?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll for Ms. Conwell. Ms. Conwell is absent. Mr. Sweeney.
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. Ms. Turner.
Present.
Mr. Miller.
Present.
You have a quorum, and let the record reflect that Councilwoman Simon is also in attendance.
Thank you very much. Is there any public comment?
No, Mr. Chair, there's no public comment submitted.
Thank you. I'm looking for the approval of minutes from the April 19th, 2023 Health and Human Services and Aging Committee.
So moved.
Second.
And moved and seconded. All in favor?
Aye.
Aye.
All opposed? The minutes are approved. Matters referred to the committee, Madam Clerk.
Resolution 2023-0111, awarding a total sum not to exceed $20,000 to the Brenda Glass Multipurpose Trauma Center for general operating support from the District 9 ARPA Community Grant Fund.
Thank you very much. Would the representative from the Brenda Glass Multipurpose Trauma Center please come up? And thank you. Just like make sure the green button's illuminated
Okay.
on the bottom there.
It is
It is.
illuminated.
We're all good. Please tell us who you are and introduce yourself, and then tell us all about the Brenda Glass Multipurpose Trauma Center.
Awesome. I am Candace Williams. I'm the Ohio State Director for the Alliance for Safety and Justice.
And I'm Brenda Glass, the Director of the Brenda Glass Multipurpose Trauma Center.
Wow, cool.
I am Shakira Diaz. I'm the Chief of Federal Advocacy for the Alliance for Safety and Justice. Real quickly, I'll just tell you who we are and why we're here supporting Brenda. We are a multi-state organization that works on reducing reliance on imprisonment and increasing investments in best practices to stop the cycle of crime. The Brenda Glass Trauma Center is one of the best models in the country, and we just want to support her.
And I also want to know that we did have a little mix-up. We sent, just before the meeting started, a package of information. It included a letter from the Executive Director, Brenda Glass, a brief 2-page overview of the evidence-based trauma recovery center model, which you also have in your folders in front of you, a 1-page explanation of the trauma recovery center core elements that make the model what it is, and the final thing in that packet was a trauma recovery center publication that provides more information and supporting data about the trauma recovery center model and survivor experiences. I will be before you very briefly before I hand it over to the Executive Director, Brenda Glass. We support trauma recovery centers across the country and have been working to grow the model. It focuses on some of the core components of the policies that we work on across the country. That's community health, support for crime survivors, rehabilitation, and crime prevention. And the Trauma Recovery Center model addresses those 4 components as well. There are 44 trauma recoveries across this country. There were 39 as of last year. There are 8 in Ohio, and they started in 2016 Ohio with then Attorney General Michael DeWine, and he supported those trauma recovery centers, 5 of them with startup funds. They have since grown to now 8 in Ohio. Brenda Glass's Trauma Recovery Center has done something that across the country has been difficult to replicate and sustain, and she has a safe housing component that is absolutely essential to crime survivors being able to regain stability after they are victimized. The last thing that I'll point to is even with her involvement in the daily practices of the Trauma Recovery Center model as a practitioner, she also lends great support to the work we do at the State House in bringing the lens of the experiences of survivors to our policy work so that it can inform our work and help create change that will further support crime survivors. And I'll hand it over to Brenda Glass.
Thank you.
Thank you for hearing us today. As the Director of the Trauma Recovery Center, I'm also a therapist. So my work kind of began when I was witnessing a lot of disparities in care for people. I saw that a lot of African Americans and Hispanics were not receiving services from agencies of your typical mental health programming, and they also were not receiving sheltering from our typical shelters. So back in 2003, it became an idea of mine to be able to find a way to, remove those barriers for people of color. So it started as a faith-based organization in 2003, working with young people who were at risk for being either victimized or re-victimized. So we started working with them on a level of a spiritual level because there was not funding at that time. So we were dependent a lot on faith-based money to come in and help us out. What we saw that it was like a viable resource. You help people with, relocation assistance, with housing, with helping them to get employment, giving them an opportunity to relax their fear or their mistrust in our systems. That way we can lead them further into getting the help that they need. So that's from 2003 to 2016. It was a faith-based initiative that we were doing, and it was working. People were getting the help that they need. They were changing their lives around. They were going on to do bigger and better things with their lives. In 2016, I was working at an agency that, at the direction of Mike DeWine, Michael Sheline and Aaron Bryant in the crime victims unit came to the agency I was working for and asked if they could create a trauma recovery center. They had seen what was happening in San Francisco, and they liked the idea, and they were having difficulty finding people that could replicate that. 2008, I had read Dr. Basalari, who was the director of that program's white paper that she wrote. And so we kind of incorporated that work in the work we were doing as the faith-based organization. So we met with Michael Sheeline. He liked the idea. And so the program was funded through that agency. So from 2017, when they launched trauma recovery centers in Ohio, I worked there providing those services there, and everyone that came through us through our faith-based initiative was actually referred into the agency because they had better resources and they was able to get more work done. 2020, that ended. It's October 8th, and November 1st, the Brenda Glass Multipurpose Trauma Center took the banner and ran with it. So we just continued to do the work. The Attorney General's office funded some of the work we were doing. Adams Board funded it as a faith-based initiative originally. The services that we offer are very comprehensive, and according to cognitive processing theory, which is what the VA uses for their trauma victims, without housing stability and supports, people are less likely to receive mental health or benefit from mental health. So we have our own safe shelter, and these two gentlemen here with us today are the ones that run the management company and own the houses.
Let's introduce them. Take it a minute. Or just introduce them, or
Okay, this is,
come on up for a second.
How you doing today? My name is Adrian Holmes.
Adrian.
I'm one of the founders of the Safe Houses, along with
Antoine Dotson, and me and him together, we co-founded the Safe Shelter, and we responsible for keeping the houses safe and a homely feeling, so victims will feel, at home when they're with us.
And safe.
Yes, that's
I can see why you have that responsibility. Thanks for coming up, man.
You got somebody else with you, though.
yeah, so this is one of my peer support advocates who is in the day-to-day operation. He's actually like employed part-time, but he really works overtime, full-time, whatever.
First name Stephen, last name Jones. I pretty much handle transportation and anything else that the trauma center needs.
That's awesome. Can't thank you enough for coming down.
Our goal is to make sure that clients don't get re-victimized and that they don't retaliate. So we work with gangbangers with, their rivalry, things that they have going on, drug deals gone bad, domestic violence, community violence of any kind. We don't discriminate who we take into our services. We leave it that broad because we know that in order to stop crime in our communities, you're gonna have to work with everybody. We're going to continue to see this cycle of violence until the people that's perpetrating violence get the help that they need, because everybody is suffering from a lot in our communities today. And so we provide psychotherapy, case management. Our case management services are very intense. While the people are in our safe shelter, they receive counseling services once a week, case management twice a week, and peer support as many times a week as they need it. We have men working with men and females working with females. We think that's a safer way to do it, so we don't have to worry about anybody being felt like they were being hit on or whatever, right? So our services began as a way of sort of like piloting that the safe shelter would work, and it's like exploded because we work with university hospitals, Metro Health, now Cleveland Clinic, Peacemakers Alliance, May Dugan Center. The county prosecutor's office refer clients to us when they have witnesses that they would like to keep safe. Pretty much every entity in this city call us for any help that they need with victims. And we deal with those victims in their acute stages. And so it's the main thing we look at first is the safety concerns that person has. Will that person be safe? And in what area they'll be safe in. So our safe shelter houses are scattered throughout the city and in the suburbs, so that we don't put a person in a safe house in the same area that they were victimized in. We felt like that was a safer way to do it because, if you have one solid building with multiple rooms, you're subject to run into each other or somebody to know where you are. This way, it's confidential, it's private, and it's safer. So, any questions you may have? I'm rattling on.
Thank you for that presentation. There will be questions for you, and it sounds wonderful, but I'm going to ask the sponsor and the councilwoman from District 9 to share some thoughts, if you don't mind.
Well, before I do that, you gave a great presentation about who you are and what you do. And good morning, Ms. Williams, Councilwoman Williams, and Ms. Diaz. It's been a while since I've seen you, but I've seen you via social media all over the country doing what you do. And we're so grateful for your service. Tell us why you're here today, Ms. Glass, and what you plan to use the funding for.
So I'm here because we do need help to keep the work going, right? So it takes funds to do whatever it is that you're doing. We have grants that we have applied for and that we are awaiting for, and we were just awarded, Councilwoman Turner, from the opera dollars for the community violence reduction dollars. So we were awarded some funds for that, but we do need funds from the county. We want to use the 20,000 that we've asked for to help us with our, general operating expenses, which will help us to continue with our safe shelter. When we relocate clients to other locations, we want to be able to help them with what the needs that they have going into their new homes, because often they come to us with nothing. So that means they're going to leave us with nothing. So we're able to help to provide resources for them if we have extra funding to be able to do that. And so if for helping us to be able to supply those funds for helping us with our salaries, with our relocation assistance, and just with our general operating costs.
Thank you. And so I don't want to be repetitive. Again, I think you gave a great presentation. I wanted to talk a little bit about our visit. I was able to visit one of your locations and met with you and your wonderful staff. Hi guys. And I was shocked to learn that you serve a lot of people in District 9. In District 9. And so I was grateful that we were connected. And the work you do is impactful and important. And I'm speaking outside of being a member of council here. I've been a victim of crime. I know victims of crime. And I am aware of what you could do to help turn somebody's life around. So I was all in when I heard that you needed some support. And so thank you for the opportunity to serve. You mentioned, the disparities in service, for African Americans and our brown brothers and sisters. And so, again, when the county declares racism as a public health crisis, I took that very seriously. And so I'm putting a very small amount, I'm so sorry, towards this cause, but I'm sure that you will grow this and expand this exponentially. I hope that your services with the county will continue to grow as well. And so thank you for all that you do. I absolutely just am begging my colleagues to support this legislation because it's really important, the work that they do. And I'm going to yield at this point to any questions my colleagues may have for you.
Thank you, Councilwoman. Councilman Miller?
So, thank you very much for coming in and for this extraordinarily important work that you do. And and I'd like to ask a broad question as to whether you think in serving people in need in our community, whether it's victims of crime or whether it's people experiencing mental health or addiction or a variety of other things, do you think that we're moving away from a model where there's one agency that deals with health, and there's one agency that deals with mental health, and there's one agency that deals with housing, and there's one agency that deals with employment, and so on, and moving toward a model where a single agency tries to provide a comprehensive program of services to meet the person's whole range of needs?
Thank you, Councilman Miller. Yes, I do. I believe that we are moving away from that model, and the Trauma Recovery Center model is that model, the comprehensive model. And the reason we do that is because we lose people in transition from one agency to another. We are likely not knowledgeable about what the person's going to encounter when they get to another agency. We can only control what goes on under our roof. And so I think that is the comprehensive model is the most effective model. We've seen it to be effective with us. Most of our clients that we've seen have gone on with their lives to do great things, and they come back to help us, like the two gentlemen that came up. Also, we have a nurse that comes and provides care for us, pro bono, for people that have wounds that come into our care on a weekly basis or a daily basis to make sure things are healing properly for them. We have school teachers that came back and tutored our kids during the COVID-19 pandemic. And so I do see this model as being a model that needs to be at the forefront of all organizations.
Thank you.
Anybody else? Madam, or Councilwoman Simon?
Thank you, Mr. Chair. So I just want to understand the referrals and how people find you. I think you spoke to the prosecutor's office, and what other sources would you have to provide?
People that come to us?
Yeah. How do they find you?
Hospitals. So we have a phone number. We give out our brochures to all of the agencies that ask for them. And matter of fact, we just started to get an MOU with Canopy for children, because we know gun violence has become prevalent in our young society today. So they have our brochures, and the clients call us, or either a social worker or nurse or doctor call us from the hospital. We go to the location and meet with the person face to face, and then we transport them to our safe shelter and to our practicing location. So individuals in the community can get us from our website. The information is there. Hospitals, every time there's a victim that comes into the hospital, they receive everybody's brochures. But, as a sidebar, they, kind of urge them to take our services. And so that's that's how it happens. And it's really interesting that the more we do the work, the more people want us to help them. The more hospital. I was surprised when Cleveland Clinic called. That was the hardest one to get into. But we now are serving 2 clients that was referred to us from Cleveland Clinic within the last 2 weeks.
So as a follow-up, with this increase in referrals possibly happening, are you going to be able to, service all the referrals? Or do you think you have to put people on a list, which isn't
Never
really
did.
ideal for this kind of work at all?
We work 24/7, Councilman Simon. We work 24/7 because we do not want someone on a waiting list. So we work Sundays, we work Saturdays, we work through the night. Because if your life is in danger, your life is in danger. You can't wait 30 days, 90 days, or even 1 day, to be able to get the help that you need. We do a mental health assessment within 24 hours after receiving a client. And their services start 1 week after that initial assessment. So we have part-time people that work with us. We have people that volunteer with us, because we don't want to ever have anybody on a wait list.
Thank you. My turn, right? Thanks for coming out. I got three points. One, is really cool talking to somebody that had a vision in 2020 or 2003. And I've talked to a lot of people. I have a thought. I really want to get a rec center. I really want to take care of the homeless. I really want to take care. And they are all passionate, and they are all. You're actually the first person I saw that brought it to the finish line from my little world. And it's even cooler that I'm talking to somebody that's the executive director, but it's named after you. I'm talking to somebody that something's named after. So tell me how that happened.
So when the Circle Health Services lost the funding for the grant, so as we were beginning to start up, we didn't have a name. So our board president, which is an attorney, suggested that we name it the Brenda Glass Multipurpose Trauma Center. And the reason she suggested that name is because everyone in the country knew Brenda Glass, because I had been doing the work for 6 years, and the Attorney General's office knew us, and people across the country. I'm on the National Alliance of Trauma Recovery Centers Steering Committee, who provide technical assistance to all trauma recovery centers that are starting up, and even those that are already started and they want to enhance their services. And so they just thought that would be the greatest idea. I didn't think about that.
You remain so humble, but just by watching, just feeling your presence right now. But you're, can't say a bad, you're well-respected, and nobody messes with you. Because of you wouldn't be as successful as you are without having street cred
Yes.
to a significant level. Okay, and my third point is doing God's work for a subset that normally doesn't get highlighted. Because it's always about, you know, the victim in the crime during the trial, the perpetrator of the crime, but what happens to the victim after it's over is something that I don't see as highlighted as, they get kind of forgotten, maybe, is my thought process. And seeing what you guys do, or you ladies do, is, and having the support from the state government is just a nice suitcase to get you where you're at right now. And I don't know if District 3, I wouldn't mind asking you to throw 10 in. I have to ask all my colleagues, though, to make it 30. I think that would help a little bit more. So it's because of you, young lady. I didn't mean to point. But
Thank you,
it's,
Councilman Sweeney.
but it's all of us, though, and we just make recommendations. So, do you have anything else for us? I mean, because for me, it's a good day meeting you.
I just want to say, the first time I came here, I was actually coming out for, I'm also on the Ryan White Planning Council, so we had to come and meet with you, and it was I was so nervous, like I am today. I don't know why.
You don't seem nervous.
But I am still on the Ryan White Planning Council, and I was thinking about that when I came here. I was like, I felt so nervous and so afraid to talk, and my words kept getting jumbled. So I prayed today that you guys were able to understand the things that I was saying. And that's why I needed these two ladies to come and support me, because I do the work. Like, I'm on the ground, and I'm working 24/7. And I don't know if I always have the right, etiquette. So if I did, not, do things correctly, please, I apologize. I'm just not used to this part. I'm used to that part.
I use street cred, and your good Lord, your prayers are answered.
Thank you.
Madam Councilwoman, you want to end it? No, Meredith. You're good?
Well, I wanted some clarification on what you were saying about the 30.
Trevor, you want to throw 10 on? What I'm trying to say is, I was moved by the presentation. I'm going to make a recommendation as the District 3 council person to add $10,000 to this particular extraordinary
I thought that's what
group
you
of
were saying.
individuals that are
Wanted
doing.
to get it on the record effectively.
Guess what? I think you could have got it from the first time. Because we can replay this.
I know.
Trevor, is that something that you can put
For
together?
the audience, I want to make sure the audience. Trevor.
You think I was going to dance on? I mean, come on. You knew what I was talking about, right?
Good afternoon, Mr. Chair, Trevor Meckler, County Council staff. Yes, if the committee's willing to send it out of committee, we can have a proposed substitute under second reading consideration at the next council meeting.
Thank you. I think that's the direction that we're going to ask you to do, and then we'll see how it turns out in the second reading after we do the amended piece of legislation.
Okay, thank you.
Thank you. Happy Wednesday.
Happy Wednesday.
Thank you so much. We appreciate
Thank you.
guys.
Thank you.
Thank you.
Any miscellaneous business?
Mr. Chair, we need a motion and a vote on that item.
I was just seeing if everybody's paying attention. Councilman Miller?
I would like to make a motion to favorably recommend 2023-0111 to the full council for second reading.
Second.
All in favor?
Aye.
Aye.
All opposed? None? Legislation 2023-0111 will be referred to the full council for second reading. Now, is there any miscellaneous business? Hearing none, this meeting stands adjourned. Thank you for your attendance and participation.